So I am super excited to be diving into a conversation with Santoshi, who we met in Porto at an integrative medicine conference. It was so exciting to find that you were an integrative medicine doctor at MD Anderson in Texas, which we'll talk about. But maybe I could start with my question about why integrative medicine matters to you.
Well, thank you, Elizabeth. It was wonderful meeting you, and I enjoyed talking to you about what integrative medicine can do for patients. It's a great question. Why integrative medicine matters. I think to answer this, I want us to step back and see how we felt in our lives when we are going through some kind of illness, because all the physicians who are listening and all the providers, we have been patients too. So we know how it feels like to be a patient, of course, with different kind of issue compared to people that I see dealing with cancer. And nobody is immune to cancer. There are also providers with cancer, and we deal with injuries. So whenever we have these illnesses, what we are looking for is that we want medical expertise. We want our physicians and providers to do the right treatment for us. But the healing does not stop there. We all want that overall approach. We want to eat healthy and help the body to heal from whatever we're dealing with. We have to have a good immune system to help us get over the illness. We want to reduce inflammation. So there are so many things that we have to do. Like we have to focus on our diet. We need to keep movement, and we need to keep less stress. So there are so many things that is needed to be done for a proper healing of this body. So I always consider this human body as very unique and special. When we integrate and combine all these things and we treat it with the right medications or procedure, then the healing is optimal. And this is where integrative medicine matters, because integrative medicine just does that. It focuses on you, the patient, as a whole person. So it's helping the patient heal from by improving their nutrition, by helping them move, by taking care of their mind and body, teaching some stress management techniques, helping with meditation and yoga, and helping them heal through music and sound, and counseling them on supplements to make sure they are not being unsafe taking supplements, which can interfere with treatments and things like that. And also combining massages and acupuncture and some of the wisdom from traditional medicine. I think integrative medicine does all, and that's why integrative medicine matters for everyone. And since I practice integrative oncology, I think it matters more to people with cancer.
Yeah. I love all of that. And I love that you're naming healing right up front. And both of us as cancer doctors really saw integrative oncology before it was called integrative oncology, where you couldn't leave anything out. You needed good nutrition. You needed really expert chemotherapy, new treatments, but you also needed that deeper mind body healing and that journey. So I want to ask you where it all began for you. Where did you get interested in integrative oncology?
So it is a long story. To make it
Yeah.
short, I was always drawn towards healing of cancer.
Mm.
And whenever I think of cancer, I think of the whole person, the person who is dealing with the cancer. It is
Mm.
cancer also. We need that precision medicine, the molecular ways of understanding cancer. We need to know which marker, which target that we need to do like a targeted therapy. So that is important. And I'm not minimizing that, but also the person who's dealing with the cancer. So how it started is I started my journey in the onco hospitalist program at MD Anderson, where I was taking care of cancer patients in an acute setting. So I would see patients who are admitted, and it was very hard to see what they go through. There is a lot of distress. There is emotional distress. There is physical distress. And we have excellent care at MD Anderson. And gladly, there is an integrative medicine department. So when I first started there, I wanted to help people with the mind body aspects of their care. So when I was a hospitalist, I would also talk to them about meditation and some breath work and breathing techniques to help them relax. So I conducted my first study, pilot of meditation for hospitalized cancer patients. So that actually drew me deeply into integrative medicine. Then I started learning more about what else we can do for this a particular patient. So then I started exploring what our integrative medicine center did, and learning more and more made my career path very clear, that this is what
Mm.
I want to do for my cancer patients. This is when I did practice the inpatient medicine, I'm able to still do it, but I wanted to do it in a dedicated way, because combining everything, there is not enough time to do everything in conventional care and integrative medicine by one person. So
Yeah.
I decided to just focus on the integrative care of the patient. So that is how my journey in integrative oncology started. And I am loving to see what it can do to our people with cancer, both in the hospital setting and in the clinic as outpatient setting. I see that patients benefit from it and patients love it and they want to continue it. And I am loving the fact that patients are improving with integrative therapies.
Yeah, that's the joy of it, isn't it? When you see someone building resilience, moving through their cancer treatments with fewer side effects. What would you say are your specialist areas within this big, broad model of integrative medicine? So, like I'm specialize in mistletoe and homeopathy, mind body communication, and something called biography, where I, open up the story, so that we can really explore ourselves. Where would you say your kind of integrative approaches lie?
Well, that is a difficult question, Elizabeth. I know that you are specialized in a lot of areas too. So it's hard for me to narrow down on one because I'm interested in more than one area.
Mm.
So when I started my career in integrative oncology, mind body was my main focus. So my
Okay.
initial publications were in meditation in cancer patients, yoga, the benefits of yoga in cancer therapies. Then further, I wanted to see how the whole integrative whole person care can do for the patient. So then my publication centered around how do we do like a real world practice, because we are able to incorporate a lot of integrative medicine principles in real world in cancer care, along with the conventional cancer care, both in outpatient setting and inpatient setting at MD Anderson Cancer Center. So those are some of my areas of research to see how the outcomes are looking, how are we incorporating this in the real world. But then I got interested in medicinal mushrooms, which you are very much into as well. And we talk
Yeah.
about it a lot when we
Yeah.
met in Porto. And I think
Yeah.
mushrooms are one of the areas that really connected us very well. And so I looked at this was again motivated by my patients asking me questions on mushroom, because I always try to keep an open mind. Of course, it is easy to say there is no evidence. And for some of our treatments, there is not much evidence. But at the same time, like, what is that we are missing? So I did a deep dive. It took me 3 years, which was a lot of time, to do an extensive systematic review of about 10 years worth of mushroom papers. It was almost 3,900 papers that
Wow.
I reviewed. And we put together a systematic review of medicinal mushrooms in cancer. So that is definitely remains my area of interest. And I did an integrative medicine fellowship, which was also combined with Eastern medicine, because I have always been interested in traditional medicine, especially Ayurveda. Of course,
Mm.
the benefit of acupuncture and traditional Chinese medicine. And I was very much also wanting to learn more about the traditional Indian medicine, which is Ayurveda. And I did a master's program also and learned a lot of those techniques and how the traditional wisdom of like helping the patient, like a personalized diet recommendation based on Ayurveda, the exercise, the type of the constitution of the person, and that personalized care. I was very fascinated, and that was my recent adventure, I would say. It was tough to take time aside, but I love learning about Ayurveda. So that is one area which I'm fascinated about right now and planning few research projects in that area. So all of these areas fascinates me. My current fascination is Ayurveda. Mushrooms still remain a fascination, but always, all-time fascination is about how do we do every single option that is out there and offer it to our people with cancer and give the best for the patient is always been the number one area which gets me interested in.
Yeah, and I'm excited by how much research you're doing. Like I can hear a lot of training, but also a lot of research. And I think that is the way to move the field of integrative medicine forward, isn't it? To actually be able to share with colleagues. And I wondered if you could talk to us a little bit about MD Anderson. How is integrative medicine, integrative oncology received? Is it something where it's growing and being allowed to flourish?
Yeah, so definitely I'll talk about that. So, one big advantage we have practicing in a comprehensive cancer center like MD Anderson is that most of the evidence informed, evidence based recommendations, of course, there's no resistance, but evidence informed recommendations or to be tailored to that particular patient. So the advantage of having the integrative medicine center within MD Anderson is that all the integrative medicine physicians or MDs with oncology experience in some way. And what we do is to make sure that we are always working in collaboration with our oncology teams or other cancer provider teams, like there is paid teams, there is a supportive care team. So there are rehab teams. So there are several departments within MD Anderson, and we always collaborate together. So that makes sure that we take care of the interactions between different treatments. We make sure that we are on the same page in terms of the cancer treatments. So this also leads to less resistance by the oncology providers. So if we do some treatments which are probably controversial, then it is going to, or it is likely to create resistance. So most of the treatments that we do is evidence informed. So there is
Right.
some level of evidence. The evidence may not be like multiple randomized controlled trials, which creates a very high level of evidence. That is very hard to see in integrative medicine practices or integrative therapies because there is not possible to get so much funding which is supported by pharma for drugs in terms of integrative therapies. So we want to have more retrospective studies, small studies, and this studies gives us good information. And there are big studies, for example, acupuncture. There is RCTs, which shows benefit of acupuncture in certain conditions. In cancer, there is joint pain, cancer pain, hot flashes. So there are good studies in our practice. So often when we are practicing along with our oncology teams in terms of offering integrative care, we make sure we are perfectly aligned. And number two is we collaborate. Number three, we practice in an evidence-informed way to ensure safety. And most important of all is that the patient is fully on board with us. So that is the most important aspect of all.
And within the cancer team, do you do cancer testing, to understand, for example, do you do any circulating cancer cells or, is there that functional element of integrative oncology available as well?
Yeah, that's a great question. So usually at MD Anderson, the circulating tumor DNA and other similar testing is done by the oncology teams. So
Wonderful.
they do usually the tumor marker testing and a lot of other cancer related testing is done by them. And what we do is we often order vitamin D levels because studies have shown that vitamin D is involved in cancer immunity. So we test for vitamin D, make sure vitamin D levels are good. Sometimes we test for B12 and B6 if a patient is on a high dose supplement, just to make sure that we are catching up on liver toxicity. If a patient is on medicinal mushrooms, we will test the liver functions. So things which are not normally tested by oncology teams, those are the things that we do, but we have a clear demarcation that oncology team will do the oncology testing and integrative medicine team will do these testing. So that makes it very clear. So the teams operate in cohesion.
Yeah, and that's an evolved practice, isn't it? Where there's trust, safety, but also people know where their boundaries are. What am I doing? What are other team members doing? And I think in the UK we're still quite separate. So, there can be trusting oncologists who might collaborate at a distance, but what you've got there is an evolved team. And do you have a multidisciplinary team meeting? Can you share across the integrative medicine arena?
Sure, sure. And I hear this very frequently, Elizabeth, that a lot of practices are evolving. And this is something that is often seen in many countries, including many other practices in the US also.
Mm,
And which is good because the integrative medicine as a field itself is a growing field. And we are all in a phase of growth and we are evolving too. We change our practice based on new research. So we are all evolving together, which is great for our field. So the second part of your question was how do we make sure that the safety is taken care of, or
Well,
did I?
it sounds like you do that by making sure that you're aligned, but also that you're not stepping on each other's toes. You know, it's like I think within any team, people knowing what their remit is
Mhm.
important, isn't it? But also people respecting and appreciating what you're doing. I wondered for our listeners whether you might share, you know, your favorite medicinal mushrooms. Like it's such a fun topic, isn't it? Because they're so interesting and relatively safe, you know. But I just wondered, you know, what are some of your favorites?
So my favorite mushroom is usually I tell people to go to the grocery store and
Mm,
get the shiitake mushroom. So shiitake is considered one of the weakest medicinal mushroom, but
mm,
the strong mushrooms that we can buy in the grocery store, at least based on where we live in Texas. There are some stores which also has other mushrooms. They do have maitake mushrooms, but there's only particular stores. But most of the grocery stores here do have shiitake mushrooms. And then people do have mushroom teas, mushroom coffees. So there's not a lot of studies on that. So I'm doing a podcast next month, and I'm planning to do a deep study and delve into it to learn more. And I will talk more about it in that podcast. But I think there is a lot of other mushrooms which are out there which needs to be studied. I think PSK deserves studies in
mm.
in cancer, in gastric cancer. And I've been working on trying to see how we can get those into research projects where we can see how we can be given along with cancer treatments and to see if there's interaction. Because few studies are also showing interaction between mushrooms and certain cancer treatments. And there is also some concern about the hormonal effect of certain mushrooms.
Mm.
And we that, for example, chagas mushroom can have some nephrotoxic effect. We know turkey tail can have some hepatotoxic effect. So we need to be aware of the side effects. So I'm very cautious in terms of recommending medicinal mushrooms as supplements. Right now, we're doing more as diet. But in the future, where we need to move forward as a field is to do clarifying studies on the interaction, clarifying studies on the safety, along with conventional treatments. And I think there is a great room of opportunity to use these medicinal mushrooms and use their immune enhancing potential along with cancer treatments.
Yeah, I do love though that you've talked about cooking with mushrooms because I often think, you know, let's keep things simple, enhance people's nutrition. We know that the mushrooms are really good for the microbiome. You may not know that Bristol is a big mushroom city. You know, like I can go to my local veg shop, Reg the Veg. I can get lion's mane, I can get shiitake, you know, and I've been slicing lion's mane up, which, you know, is very good for helping the gut, but also GABA and, you know, good for stress processes. So, and I have, you know, Kifas Terra, I think, have been doing some very good research. They did one study with bowel cancer showing improvements in symptoms. That was a placebo control trial, I think. You know, I so love your caution and just starting simply with things that are available. One who was doing our master's at level 7 diploma or 2-year training, she actually hadn't cooked the shiitake well enough and got some reaction to it. So that's the other thing I would say to my patients. If you're cooking more unusual mushrooms, just really cook them well, you know, and
Yeah.
because we're learning about them, aren't we?
Yeah, we are. And it's very interesting. I would love to visit your place and try all the mushrooms and enjoy them. But you brought up a very good point about cooking mushrooms.
Mm,
Mushrooms do have toxins in them, and we need to cook it
mm,
properly, eliminate those toxins. And also, I think for the benefit, like Japan has done like wonderful number of studies in medicinal
mm,
mushrooms. They have a meta-analysis done on gastric cancer and PSK. The
mm.
PSK is one of the active ingredient of turkey tail mushroom. And they seem to use mostly hot water extracts. So I always tell patients, you cook it, number one, to get the benefit, number two, to take away the toxin. So you
Mm.
brought up a very good point, Elizabeth.
Yeah,
Thank you for that.
yeah. And then I say don't forget the lovely chestnut mushroom that, leaving them out to add vitamin D. It's just mushrooms every day with lots of different types, can be a wonderful addition, particularly when people's diet has been a bit neutral. They've just cooked the same things or maybe microwave food. It's a great way, to get a lovely stir fry with oyster mushroom and chestnut mushroom and yeah, just enjoying food as well.
Absolutely. Like how you said, enjoying food also matters. So that is something that, I also tell my patients, like if they are enjoying it and if they're eating cruciferous vegetables, especially, for example,
Mhm.
they can have a lot of benefits, maybe almost like taking a supplement, but without too much side effects. So yeah, there's a lot about nutrition. But I also wanted to go back to your question on the
Yeah.
multidisciplinary teams. I think
Yes.
I to answer that. So we do have a couple of different team meetings. So we have an inpatient meeting, which happens once a week in the afternoon, and we have a overall IDT, interdisciplinary team meetings. So in terms of our IDT, the interdisciplinary team meetings, we actually present cases, and that is a team meeting which is attended by all integrative medicine section members, the clinical members of the team. That includes acupuncture therapist, massage therapist, yoga therapist, music therapist, nutritionist, physical therapist, psychologist, our physicians, our nurse practitioners. So we all are nurses and our PSCs. So we all attend together and brainstorm and see, are we offering everything that we have for this particular patient? Or what should we do different? And how can we tailor the treatment for this particular patient? So that is one multidisciplinary team meeting that we have every week. We also have a dedicated inpatient meeting that is more for coordination of care. Like, how's this patient coming along? Are they responding well to acupuncture? Should we switch them to something else? How is the massage going for them? How is their mental health? Should we add music? Should we add massage? Should we add yoga therapy or meditation? So these are the two different types of multidisciplinary team meetings we have. And then if we have to reach out to other teams, we reach out. Email is our communication where a lot of team members are copied, like an oncologist and a pain team and a psychiatry team. So that happens for coordination of care as well.
This is like my dream come true if I could see that happening regularly in the UK. Can I ask, how's it funded?
So the funding usually for the physician is based on the insurance. So
Okay.
we operate as any other physician. So any physician who will bill for their service, that's how our billing works as well. So we would bill for the symptom management like fatigue, nausea. So those are the codes we use. So it is like any other practice. In terms of the services that we offer, acupuncture, it would be great to see, like how you were talking about your dream. Our dream is to see 100% coverage, but
Mm.
we are not there yet in the US. But some insurances do cover acupuncture for cancer related symptoms. So patients often tell us that if because their symptom was cancer related, it was covered. And usually we use, if there's a cancer related pain that we're treating, we usually use cancer related pain code and cancer related fatigue code. So that tends to be covered. For neuropathy, we use acupuncture for heart, due to the chemo-related neuropathy, hot flashes from aromatase inhibitor. So a lot of those symptoms are cancer-related and tend to be covered. Some people, they have to pay in private because their insurance doesn't cover it. So it's not universal coverage. When it comes to massage, that drops off few more insurances. So the coverage is not as wide as acupuncture, but still people do mention that their insurance are covering this many massages, medical massages, or oncology massage that we offer in our clinic. So oncology massage coverage is also not 100%, but it's there. When it comes to music therapy and yoga therapy, it comes from out of pocket from the patient. So we have also created free resources. So we have group classes that people do not have to pay, and
Right.
thank from the philanthropic funding that is supported. And the group classes, or we usually refer people to the group classes. They can do music therapy, they can do yoga, meditation through in a group. If they need one-on-one attention, then there is a charge for that.
So it's very interesting to see that economics at play, because we have paid for services at the National Centre for Integrative Medicine, but we do have bursaries. And they're
Mm.
philanthropically provided so that people aren't turned away because they can't afford it. But I would love to see the NHS really. I wondered, Santoshi, have you seen any research that compared a cohort of cancer patients having integrative oncology with those that aren't? Because that to me would be a really interesting study to see how it might enhance symptom control, but also even impact on longevity. So I'm just wondering if those studies, if you've seen any like that.
Yeah, that will be a wonderful study to measure longevity. So
Yeah.
far, to my knowledge, longevity is not has not been a secondary outcome in
Yeah.
integrative medicine studies. I think that is mainly because we need long-term follow-up. And
Yes.
we are right now, there's a limited funding in integrative medicine field for studies. So people only have money for short-term follow-up. But that would be interesting to see in the future
Mm.
get funded. But right now, I'm working on a project in GI cancer patients, people who were referred to integrative medicine versus people who were not referred to integrative medicine, and compare and contrast and see what is the difference. But I'm sure there are studies out there. I'm not able to pinpoint like one study at the top of my head right now to share with you on what exactly happened. But the study that we're working on should show some difference between the people who do see integrative oncology versus people who don't.
Great.
But I think we should also do it in a multi-center way, because if you look at one center pattern, for example, if I look at mainly our center, most people who are appropriate for integrative medicine are already referred, and they do report good outcomes. And the patients who are not referred are probably people who are not appropriate referral to integrative medicine. But I don't know that yet. So that is exactly the purpose of my study that I'm going to find out in a few days when we analyze the data. But that would be a very good database to show that integrative oncology improves outcomes for sure.
I'd
Right
love
now, the studies are
Yeah.
designed like one intervention, one outcome. And I know we have been talking about this, that we have to do the whole intervention and study on whole outcomes in our field.
Yeah, I'm so excited by that. I'd love to hear, because my PhD was about complex interventions, that you can't just start to look at one element and one element, but it sounds like you're choosing one kind of area of cancer medicine with gastrointestinal, did you say? Yeah.
That is
And
correct.
then you look at the model that offers, multimodal approaches. And then you're looking at symptom burden, quality of life, spirituality. Is it those the kind of outcome measures you're looking at?
Yes, yes. We are trying to see the differences in referral patterns, the outcome measures. As a part of our protocol, we collect the data on patient-reported outcomes. We collect ESAS, Edmonton Symptom Assessment Scale, which talks about pain, fatigue, nausea, and several other factors. We use ESAS FS, which also collects information on spiritual distress, on financial distress, and other
Mhm.
measures. So we will see what is the difference, what is causing the difference in referral, or how after intervention, what impact does it make. So those are some of the areas that we are trying to measure. Of course, there will be a difference because people who are referred to us have that scale, whereas people who are not referred to us may not have that symptom burden scale.
Yeah.
So there are some nuances in such type of study, especially when it's a retrospective study. We have some limitations. I think this would be great if we design it in a prospective manner and then see. But again, the question would be, how do we not take a patient who's appropriate for integrative medicine. So it's kind of very hard to do prospectively, ethically, but in some way, if we can show that, that would be wonderful. That the difference we can make.
Yes, as patients become more empowered, they don't want the roll of the dice. So one of my colleagues in the UK looked at cohort studies where you would randomize people into a large cohort and just say, look, we want to just follow you up over time. And that would be, again, a fantastic thing, that what you would do is not alter their choices or what they use, but you'd be able to match within that cohort for someone who did choose integrative approaches versus someone who didn't, but without manipulating. So that's expensive, though, as a research model, because you need quite a big cohort in order to do that. But yeah, it's important.
Absolutely.
Mm.
I think that falls into your area of expertise. You had shared that your PhD was in complex models of
Yes.
multimodal intervention. So we need to have another conversation on that. But that sounds exactly like your line of work and
Yes,
expertise to
because
do.
in a way you want to leave the complexity untouched, but still
Mhm.
research it without interfering with it.
Mhm.
Of course, that some of the really interesting research that I studied many years ago was this idea of what the researcher called self-regulation. He could see that there were people doing better with cancer, and he even developed a score called the self-regulation score. And that was
Mhm.
like thinking outside the box, using unusual approaches, staying in charge,
Mhm.
the interesting areas of self-regulation. And so he had this cohort. Then he randomized high self-regulators to either mistletoe or no mistletoe. And he could see that there was a survival advantage. Now, it would be great to repeat that, but what you need are people with big picture who take time. You said that right at the beginning, in order to kind of look at survival, you need to follow people up over a long period of time. So yeah, I think this whole area of research is fascinating. And
Yes,
the
yes.
fact that you're so research active is wonderful.
Yeah, and I think I see that as a way forward for our field and to be able to make sure that the oncologist feels safe with integrative medicine. I
Yeah.
think is a common language. And these are all about the long term outcomes that we were talking about. In terms of short term outcomes, we have published in like a very short interventions. For example, one session of yoga, one session of Tai Chi as a group. We have shown that it makes improvement in patients' symptom burden scores. Even after
Mm.
one session, people with high symptom burden report an improvement. So, in short term analysis that we can do at this point, there is a lot of outcome improvements like PRO improvements, patient reported outcome improvements that we can assess.
Mm.
So, we can say that patients are benefiting from it. But as you said, a complex model with long term outcome and longevity and cancer survival outcomes will be the way to go for the future.
And I really love that thing that you just said, that let's try and make our oncology colleagues feel safe, because they are trying to protect their patients and they take their responsibility very seriously, because they're using, high tech, high impact treatments. So I
Mhm.
think that's a lovely, sympathetic approach, rather than that sense of, well, we're doing something better than them. Do you see what I mean? It's like, how do we
Yeah.
create safety for them? Yeah.
Yeah, I agree. I agree. I think the ASCO-SIO guidelines are one example in that area. So American Society of Clinical Oncology partnered with Society of Integrative Oncology, and such partnerships coming up with a guideline. For example, we have a pain guideline, we have an anxiety depression guideline. So I think partnerships like that, which look at evidence-based approach of what integrative studies are out there and how can we create these guidelines, I think those create a lot of value. So we can use that as talking points if a particular oncologist is not comfortable, for example, with us doing acupuncture during chemotherapy. We often use guidelines and to talk about it and say, hey, we have done this before. Acupuncture can be used safely for chemo-related neuropathy. You can continue your chemotherapy and we will monitor the counts. And if there is any concern on safety, if there ANC falls down, if their platelet falls down, we are going to make sure that we stop the treatments. But that does not give a reason to completely stop acupuncture during chemotherapy. So such conversations with oncologists make them more comfortable too, and the guidelines matter for those.
It's huge. And I was going to come on to the Society of Integrative Oncology. I know you've been a leader in that field. Also, for us in the UK, it was those SIO, ASCO guidelines for mistletoe that also where, the evidence for improving quality of life in breast cancer were published. Then that had a very big impact because, again, it reassured clinicians that this
Mm.
was an evidence-based approach that could enhance quality of life. And then more recently, there was a study published showing that mistletoe could actually enhance the effect of checkpoint inhibitor cancer
Mm.
treatment. So suddenly, again, you've got this integrative medicine, the way things can come together to actually enhance outcome.
Yeah, and that is wonderful that the direction that we are taking in terms of how we need to study the supplements in our field, the direction is also in a very appropriate place right now. Like how you talked about the mistletoe and how it is
Mhm.
studied, that supplements need to be studied that way. Several supplements out there. And I think this is a very good direction that we're taking as a field to make sure that we have studies to support safety, to support traction, and make sure there is no adverse effects, and offering it to patients in a safe, evidence-informed manner. That sounds wonderful for our
Yeah.
field.
One of one of my great pleasures in setting up the diploma, which is going into its 8th year now, training healthcare providers, was that I learned a lot more about Ayurveda. So I do want to I want to tease that out a little bit with you, but just to say that where I felt Ayurveda really taught me a lot was the idea that what becomes a ritual in our lives can enhance our health. And I would say that beautiful element of rhythms, but I wondered if you might say a little bit more about what you love about Ayurveda and how it informs your practice.
Sure. So, first of all, kudos to you on educating clinicians. I think it's
Mm,
important aspect of our field,
yeah,
the clinical practice, the research aspect, and the education,
yeah.
and that is a very important aspect to
Mm,
train future clinicians. Kudos to you. So,
thank
when it comes to Ayurveda, the daily ritual that you're talking about is called dinacharya. That is what you do on a daily basis. Dina means daily, and what are the things that you're supposed to do. That is very fascinating.
mm,
And it's mostly habit forming. What it is like a way of living. How do you live and how do you treat your body? And Ayurveda, fascinating aspect for me is how it is focusing on bringing the body to its natural equilibrium or balance, to its
mm,
natural physiology. So you balance all you actually try to fix a lot of imbalances in the body so the body can reach the full potential for healing. So that's the fascinating aspect for me. So often Ayurvedic physicians, and I was trained in this too, they do a pulse diagnosis. And it took a very long time for me to learn the pulse diagnosis because it requires a lot of practice. And then you correlate with the symptom. And I also feel like it's a very nice bonding time between the patient and the physician to feel the
mm,
first
mm.
time. That's one of the first things that you do when it creates a special bond. And then when you feel the pulse and you talk to the person, and like conventional medicine, Ayurveda has history taking, a physical exam, and other aspects of medical examination methods. So you talk to the patient, you feel the pulse, you listen to them. And there's also questions about the digestion. That is one aspect of Ayurveda, which we don't have much in our conventional medicine, where we don't talk a lot about digestion unless there are some concerns in the GI tract. Whereas in Ayurveda, you always ask about the digestion, their stools, the bowel habits, and everything. Because now we know that gut microbiome and its role in immunity. I think Ayurveda has this understanding many years ago on the role of gut and the involvement of gut microbiome in the human body as a whole. So, by understanding one's digestion, you also get an idea of metabolism, toxin accumulation. And with all these tools, you design a diet for patient. You design like the physical activity for the patient based on their constitution, based on their imbalances. And then you try to first get them back to their original health. And it is believed that when the body restores to its original function optimally, it is going to be in a prime position to heal. And the digestion is restored, the metabolism is back. And that is the aspect that fascinates me about
Yeah.
Ayurveda. Back to track.
I love that. And you kind of began with that point that we've got this amazing complex body. It orchestrates so many things minute by minute, moment by moment. It has this ability to heal. So let's give it what it needs. And I also love this thing about the bond, because, like when I go for my acupuncture, even though, I'm a Western trained doctor, when my TCM practitioner does my pulses, I love it. And everything slows down, and I don't quite understand how it works, but I know he's taking great care. And then, I say, how are my pulses? So I think this idea, also of the way we connect, the way we can slow the consultation down, where we can personalize it. Those are important things, aren't they, in showing real care to somebody else?
Yeah, I completely agree with you on that. I have similar experience like you too, like
Mm,
it's taken on me. That itself is kind of calming and therapeutic. So
mm,
pulse diag I think it's both diagnostic and therapeutic, but yeah, having the connection, I think it's more important in integrative medicine, especially to have that connection because sometimes like our patients want to take a lot of supplements, like people have 20 or 30 on the list because people do a lot of research and now
mm,
AI playing a role. So often I'm seeing a pattern where ChatGPT or Copilot or one of the AI tools have
mm,
given a list of supplements to take.
mm.
Of course, there is a disclaimer which says consult with your physician. And this is not medical advice, right? But often our patients want to know. So they start taking some and they want to know and they will. So having that connection built and open communication and trust helps when we communicate about these and when I sometimes share, like, this is going to interact with your tamoxifen and this is not supposed to be taken, that there is a level of trust that is needed for the patient to trust that recommendation. So I think, as you said, the open communication, the connection with the patient, and trust are all important aspects of integrative
They're so
medicine.
important. I think some studies have shown that 60% of cancer patients use some kind of integrative approach, but less than 30% communicate it. So, and I think that
Yeah,
some patients are so troubled that they'll just have a blanket, don't take anything, that they then don't share. So I think when the clinician, has studied, understood, can talk more openly about potential side effects, that's very rich, isn't it? And supportive.
absolutely, absolutely. Yeah, I remember that study. A lot of people were not sharing, and that was
Yeah.
a little bit scary. And there was also one more study which showed that I the number was I'm not sure 50 or 60% of the oncologists were not initiating the conversation because this is not their area. So I don't expect them to. There
Mm,
is not training in this area in medical school. So unless they are have a specific interest in integrative medicine, and I think that's where programs like yours of training the
mm,
physicians and oncology providers can play a role. And there's also data on the people's beliefs that 1 in 4 Americans believe alternative medicine can cure cancer. So that was a survey that came out.
mm,
So people have the strong belief, but we want them not to be misdirected into a lot of treatments and give up conventional care and
mm.
then have more complications or the cancer growing. And that brings the value of how everything can be safely integrated in one place. And the patients don't have to feel that they have to hide something. It's very unfortunate that people felt like not comfortable sharing their CAM treatments, like complementary alternative medicine. At the time of the study, it was called that. Now it's called CIM, complementary integrative medicine.
Mm,
But at the time of the study, which showed there was a difference, people were not saying it. It's very unfortunate that people felt so uncomfortable.
yeah.
So I think more education, research, this discomfort can be removed and people can talk more openly.
Yes, and one of my patients last week, has real fears around chemo, but I was saying, let's keep it on the table. I'm not pressurizing her, but I'm keeping it on the table because I know that she's had, recurrent breast cancer. This is the third recurrence. So it's like, the exploring carefully what people's fears or beliefs might be, and then
Mhm.
some of those difficult conversations. And I think that's why being in a team, an oncologist just might not be able to go there, but he knows that you're in the room next door and can go there and have that conversation. We have to end in a minute, but I just wanted to say that also Ayurveda for me, as well as this incredible focus on gut health, also has this model of understanding for fasting. So that's an area that I'm getting more interested in with integrative oncology, is the idea of, being able to protect healthy cells with fasting. But again, that needs to be very carefully supported, rather than people just feeling like they have to do it on their own, because that same lady I mentioned tried to do it on her own and then, lost weight, felt unwell. So again, it's not the integrative approach, but it's how it's supported within, the whole picture. So I just wondered if you had a few final things you wanted to share with us, or you talked about the direction of travel, maybe where you'd love to see integrative oncology, integrative medicine going, whatever you'd like to end our wonderful conversation with.
Well, it was indeed wonderful talking to you, and I would love to talk to you more on various aspects of our common interests. But
Mm.
I think what I want to say is, as a person and as providers and as patients, we all need to take care of ourselves and the people
Mm.
we care for, family and patients. And then it's the simple way to think about it, and also a structured way to think about it, is take care of diet, make sure we eat healthy, limit the processed foods, and movement is so important. And mind body health, exercise regularly, take care of mind and body. If you are a cancer patient, seek guidance on when you can move, how you can move, where you can move, how to take care of your meditation. Use all the techniques for relaxation. That is as equally important as caring for the cancer or cancer treatment. Self care and mind body health. And be cautious in terms of what supplements you're using, contamination risk, adverse effect, and talk to your doctor. Ideally, an integrative medicine physician, or somebody who has some training in that area. And overall, I think just being cautious that we are not just one organ system, that we are a whole people with emotions and body and a complex mechanism as a human, and kindness and spirituality, and all of these matters to us, and the way we treat ourselves and the way we care for people we see as family, and people who are our patients, who are loved ones of somebody. So those aspects are something to be integrated in our daily lives.
So,
So
so
thank
beautiful.
you,
So
Elizabeth. It was
beautiful.
wonderful to
And I
talk to
just
you.
love knowing that you're there in this high-tech hospital. There you are offering all this beautiful wisdom. So thank you so much for your time. And yeah, thank you.